holiday cheer. It fills the air. But with all the deadlines, financial stress, travel, fatigue, holiday shopping, holiday pressure, family gatherings, high expectations, loneliness, the loss of loved ones, and the list goes on. That cheer dims. The National Alliance on Mental Illness found that 64% of people living with mental illness reported that their conditions worsened around the holidays. Nurse practitioner Jerry Power is an advanced practice lead for Mercy Go Health Urgent Care. Power says during the holidays, patients experiencing severe cases of depression are seen in the emergency room.
When you get to the level then like emergency care, then we see a lot of people who are suicidal. So we see a lot more suicidal and mental health stuff at that level during the holidays.
This is a very busy time of year in our emergency rooms, especially with behavioral health patients. Mental health crises definitely become exacerbated during the holiday season. Patients often become overwhelmed and desperate for help.
Molly Dwyer-Simonsen is the regional director of Mercy's Outpatient Behavioral Health. She says anyone may suffer from holiday stress and holiday blues. In fact, it's perfectly normal when the holidays aren't merry and bright.
For many of us, it's a time where we end up feeling more rushed. We have less time for our routine. We get out of our routine with our children or our families, and we have added stressors that typically only present themselves during the holidays.
Dwyer-Simonsen says December is a tough month.
In our state of Missouri, we have things like seasonal affective disorder. So we have less daylight. It's a colder time of year. We have more difficulties getting out and about. But we also have the stressors of the end of the year things. So in addition to the holidays, we may be having times of financial distress, thinking about that tax season approaching.
For those who believe they would suffer from holiday stress and depression, she says there are ways to cope by planning management of your own mental health in advance. And it's not too late to start.
I think the keys for making sure that you have what I call a successful holiday season are being prepared, recognizing those distressing emotions when you're having them, giving yourself permission to feel them versus denying them or criticizing yourself for having them. Limit your social media. Scrolling through all of the things that you see others doing can really lead to that compare and despair cycle that sabotages our wellness during the holidays. Set your limits and boundaries. Family, friends, yourself. What do you really have for time, energy, effort, and finances in advance of the holidays versus reacting in the moment? And then reaching out, staying connected with other people. This is a great time to volunteer if you don't have family or friends that you routinely gather with. It's also a good chance to prioritize yourself. Be intentional. Start to think about what that routine is going to look like. It could be something simple like daily breathing exercises, a morning devotional, or simply sipping your coffee and looking outside. I'm a big advocate of checking in with yourself on a daily basis. So mentally, what do my thoughts look like today? Are those thoughts a positive outlook or are they a negative outlook? How am I talking to myself? Am I affirming the things that I think I'm doing well, or do I find myself criticizing myself?
She says there is community support.
So we'd love for patients to be utilizing 988. We can text that. It's available for our Missouri patients that are struggling with mental health crises.
And help is available through Mercy.
You can access Mercy behavioral health resources by going to mercy.net or calling our intake line at 314-251-0555.
If immediate care is needed, Mercy Go Health Urgent Care welcomes patients.
Can evaluate you, determine kind of what the best treatment is, and if we need to go to the emergency department that time, we can help facilitate that.